Tidwell Enduro Mountain Bike Training. Hope you guys are doing well. Today we got part 2 of our little end of season fixes, and we're going to focus on kind of the shoulder neck area. Last time in video number 1, which you can check out here, we talked about your hips and your pelvis. We went into some hamstring ball work, some deep ball work into the glute. We did some banded distractions, all to help that pelvis work a little bit better and have some of those muscles that get really tight and bound up over the season in your hip area to start to get those to relax so that it sets you up for a good off-season training program to start soon. So we want to take kind of the same theory and talk about the shoulder and the arm today, because obviously as much as our pelvis and hips are to our legs, our shoulder girdle is to the function of our arms. Okay, so as much as we can get all jacked up here as it relates to tissue issues, adhesed tissue, and things like that, we can get the same thing in our shoulders and our ribs. So take a walk with me like usual, because I'm a self-video guy. Let's do a little edumacation. So here we have the shoulder girdle, right? So that's what it looks like when it's naked and doesn't have its clothing of muscles on it. These muscles actually come over and attach onto the arm, which provides a lot of stability for the arm as you go through ranges of motions. The big old lat, this big lat muscle over here, comes up underneath and attaches on, believe it or not, the front of the arm. Okay, so knowing that the lat attaches down here into the pelvis, and really we just kind of say the opposite glute goes over to the opposite lat and creates this nice strong X or cross pattern in the back. We want to consider how the lats and these muscles that attach the teres minor and major group over here onto the arm. So we want to be able to essentially help that those muscles, those three muscles, the lats and the teres, do their job better by allowing them to relax. Okay, so when we allow these to relax, we allow for separation between the scapula and the arm, right? So if these are tight and these are bound up and your arm moves, it'll drag that scapula along, and the brain is saying no. So it'll try to tighten it down, and soon you'll have real big tightness here in the serratus and the muscles that actually keep and hold the front part, this side of the scapula, to the rib cage. Sorry if that doesn't make sense, it's kind of complicated, but this scapula is designed to do all kinds of different moves so that the arm can move in all its different directions, and we need that as mountain bikers. All right, so let's go into addressing some of these tissue issues. We're going to get into some of the pec stuff because that actually affects us as well, and then also we're going to learn about how to hit some of this first rib action, so you can see the first rib there, and how it can create dysfunction and or no movement, little movement, restricted movement of the scapula as well, especially as you go into an arm up or raising your arm overhead type of move. Okay, so taking a walk, going back out. Starting with, here, let's do it this way. Grab your lacrosse ball. That's what we're starting with. You can take a lacrosse ball. You can take a baseball or a softball, or the white ball that we used to do our gut smash for our breathing last time. You can use one of these too. So it really depends on your tolerance and how much you want to hurt yourself. So I'll show you with the big ball just because it's easier to demo on. But basically what you're going to do is to lay on top of the ball just like we did with the diaphragm smash that we did last time in one. So all I'm doing is I'm going to roll through this tissue and just try to get it to loosen up as well. So I got a spot right here, which would be, for me, so you know, it's like right here, and it's about 1 inch away from where it attaches to my arm. So my pec attaches to my arm, and my lat also attaches to my arm, okay? And they do it right next to each other. So in that junction, you can get a lot of tissue adhesion in there. So I'm just moving back and forth. Again, remember, anytime you use a ball or a self-therapy tool, foam roller, stick, etc., you're searching and destroying, okay? So I've got it lower now, and I'm working through it. And this feels really good. My hand and my arm are relaxed, kind of driving it with my body. I'm using my left toes to kind of push me along. Okay, and that'll really help open up the anterior portion of this pec minor and major, which also, when get tight, can restrict and create some kind of numbness in the arm sometimes, which if you get arm pump or hand pump or excessive hand fatigue, it can be caused by tight pec minors. And remember, when you have tight pec minors, like most of us do, it makes you do this. And we know what poor posture does based off of our conversation that we had last time. All right, so pec smash with a ball, lacrosse ball, or softball, etc. Now, we move up on the other side of the body. We can get into some good tricep and lat smashing. So if you have a bar, it's great to do at the gym. If you have a Smith machine, it's about the only good thing that the Smith machine is good for is smashing. So our tricep also attaches, there's a particular long head of the tricep that attaches to your scapula. And obviously the triceps come down and attach to the elbow. So it's your essentially triceps version of attaching to the scapula, just like the lat is coming up, partially attaching to the scapula and then coming to the arm, okay? So we can hit the lat and the triceps all at one time on the bar. So here's my smooth part. I'm just gonna go overhead. I'm gonna grab so I'm holding on, and I can get into this lat stuff and Terry's stuff that I showed you on the skeleton right along your scapula here. You'll feel it. There's no doubt you'll feel it. So I got some stuff in there. I'll turn a little bit to hit a little more posterior, and then I'll get up into the armpit. Up into the armpit area, you got kind of this transition area where the lat comes up and around, okay? So you can get some junky stuff in here for sure. So right there is a good spot that I'm just gonna spend some time on. I'm gonna lean forward a little bit. I'm gonna lean back again. Just searching and destroying. Make sure you don't stop breathing. You always breathe. I'm just working through this tissue. Sometimes I'll just allow my arm to hang and I'll just kind of go over it as well. Okay, now tricep, I can just hit from elbow all the way into my armpit. Okay, and you can see I can turn my hand and then I can start working it outwards and vice versa as I come down. So anywhere in your search and destroy that you discover issues is where you want to go. Some of you will get it up high. Some of you will get it low if you have any kind of elbow issues or you've had trauma to your elbow, you know, whether it's a get off the bike or whatever the case. You'll discover that as you go through your search and destroy, which is exactly why we do search and destroy. Okay, that's a great one. Obviously do both sides. Now, this one, I mentioned the first rib. Now we're going to take a lacrosse ball and go to the corner of a wall, okay? So we're going to try to find that first rib, and all you're going to do is just come right down, right above your clavicle, between the top of your trap and your clavicle, right in the middle. If you push in there, you're going to feel your first rib. And what happens a lot of times is that first rib gets elevated, or it becomes, I'm not going to say dislocated, but it becomes subluxed for whatever reasons, particularly if you land on your shoulder. If you had any kind of clavicle trauma, whiplash, you name it, that first rib can become subluxed. So we want to get that back in. It's an accessory breathing muscle attachment and then overhead function, like I mentioned earlier. So one way we can do that, take our ball, get onto all fours, and you're just going to put the ball on the wall. Okay, so I'm on all fours. I have that ball right on the wall. And all I'm going to do is inhale. I'm going to apply a pressure into the wall, lightly. I'm going to hold for 5 seconds, holding my breath, and then relax. And I'm just going to move it around a little bit. And then I'm going to inhale, hold for 5, push, 1, 2, 3, 4, 5, and then relax, exhale, and move it around. Okay? So again, if I'm looking at it from that view, this is where the ball is. I'm pushing the ball into the wall, and then when I relax, I'm just kind of massaging through this area. So for a lot of you who have knots up in this trap, this is a great one to do because you can hit those knots in your upper trap that you can't get when you're leaning up against the wall. Okay? So you can do a nice little, woo, come back here, ball. A nice little trap move to help with a lot of the knots that we get here. And we can't get when they're up against the wall because it's back here instead. So try this guy. Be careful with it. Do it easy and slow like you always would. Use your breathing like I just demonstrated. But that really helps, particularly with nerve impingement and entrapment of the nerves that come out of the cervical spine and go into and innervate the arm and its function and movement. So again, if you get any kind of numbness, tingling, forearm issues, pump, that kind of thing, this one can really help on that. Okay? Now, the last one, we'll get our foam roller. Come for me on yet another journey. Foam roller. And lastly, we're going to help with, you know, we talked about posture last time, and we always do, about rider posture, about daily lifestyle, workplace posture, being really rounded in the upper spine, okay? So one thing we can do is get some good extension by using the foam roller here. So what I'm going to have you do is, so right here is the bottom of my rib cage. You can see my ribs because my ribs stick out. And from here up is my rib cage, okay? You want to be on your rib cage. I'm going to say hands behind your neck and squeeze your head so that you've got it such that it will not move. This is not a neck moving exercise, okay? This is a thoracic extension exercise, okay? So we're here, and we start low, okay? So I'm basically right about here level with my foam roller. Don't go this way into your lower back, by the way, because your lower back will not be happy with that. So I'm here, I'm going to inhale, and what I'm going to do is exhale, watch carefully, exhale and continue to extend. So I stop about right here. I'm going to keep exhaling for 3 seconds. 1, 2, 3. Inhale and come up, okay? I'm going to do that 3 times at this section, or this segment even better, okay? So I'll do it sideways. So I'm going to inhale, exhale slowly. I stop here because I can't go any further, but I keep exhaling for 3 seconds. 1, 2, 3. And then I inhale and come up. I do it again on the same one. Inhale. You can see I went farther this time. Exhale. 1, 2, 3. Inhale. Okay? Now, here's what we're doing. Now I'm going to roll my body down, and my roller goes up to the next segment. And then I do the same pattern 3 times that I just showed you. Again, inhale, exhale, as far as I can go, not forcing it. And once I stop, I exhale. 1, 2, 3, inhale. Okay? That's what you do. After that 3rd time, you move down again. You do 3 here, you move down again. And then typically, right as you get close to the upper shoulders, you really can't get much benefit out of it. So then I just say, hold and roll. And just roll it. Okay? And we can roll side to side too, where I'm here and I've got my right side emphasis along the muscles of the spine, left side emphasis along the muscles of the spine. And that just feels really good to get those thoracic muscles nice and limbered up. as well as creating an extension moment in those particular segments of your T-spine, which helps again with that posture. Okay, so between video number 1 and video number 2, we address the hips, we address the shoulders, 2 areas again that need to be mobile. Remember, your hips are designed to be mobile. I've got a lot of range of motion in my hips. Okay, the T-spine is designed to be rotary. Got a lot of rotation there that if you have poor posture, you can't use. I also have another mobile joint, and that is my glenohumeral joint, where I've got a lot of range that I can use. Okay, and then in the neck, we have one first and second, C1, C2, where we get a majority of our rotation in our neck. So these kinds of things can help with those tissue issues and the end of season muscle dysfunctions that we've gotten from all the time that we've spent on our bike all season long. So revisit video number 1, do this video number 2 on a regular basis here. That'll set you up nicely for a good November, say, start for your training for 2017 season, or whatever year this happens to be that you're watching it. So try these. Of course, if you have any questions, info@enduromtbtraining.com. Check us out on Facebook at enduromtbtraining, as well as Instagram. And go over to our website, enduromtbtraining.com. Check out any of our programs that we have. They can help you be the best rider you can be. Till next time, thank you.